Hi, this is Sherry from Fashion Studio 7 magazine, and today we're at the Toronto Cosmetic Surgery Institute here in Toronto, and we're going to be talking to a very talented and interesting cosmetic surgeon, Dr. Martin Jugenberg. Hi, thanks for having us here. Our readers have really been wanting to, get a lot of information about plastic surgeries and different procedures, and today we get a chance to talk to you about this, and you're going to give us a lot of information and feedback and hopefully help out our readers and, give us a little bit of information.
Well, thanks, Sherry, for coming. Thanks, Fashion 7 magazine. I'll be excited to show you our facility and tell you more about what we do here at the Toronto Cosmetic Surgery Institute.
Okay, let's go inside.
So this is our treatment room where we perform consultations and minor treatments such as Botox and fillers. We also do some sizing here for our breast augmentation patients. As you can see in our display cabinet, we have a lot of different implants that patients can try to determine what size and shape looks best on them. It's a great way to try out the implants before you actually go ahead and have a breast augmentation surgery. Up on the upper shelf we have our fillers, which we use to treat facial aging. We do Botox and fillers for wrinkles, and that is very popular with a lot of our patients.
So do the patients get to touch them?
Absolutely. Would you
like?
Yeah,
sure. That'd be great. So what are the different kinds that you have here?
So we have all the different implants that are available in Canada. This is a round silicone-based implant. It's got a smooth shape, and you can kind of feels very, very natural.
Yes, feels very real.
We have all kinds of sizes and shapes, and so what we do is we measure each patient to determine which implant size and shape fits their body best. They can try it on. We have sizing bras, and we have a nice big mirror that they can look into and see what look and what size and shape they like the best before they agree to have the surgery. Okay. So these are breast implants. The other things we have here, we have some other implants. These are shaped teardrop implants, which are usually used for breast cancer. In addition to cosmetic surgery, I also do a lot of breast cancer reconstruction, and this is an ideal implant, reconstructing a breast. And then here's another one that's pretty hot these days. Let's look at this one. This is a solid silicone implant. This is used for butt implants. We do a lot of butt implants as well. And then for some patients...
What's this made out of?
It's made of silicone, but it's solid silicone. This silicone is a little more gooey silicone. It's also known as the gummy bear silicone. This is a more solid, harder silicone for the butts. Now, in addition to implants, what's also very, very popular is using your own fat, a procedure called the Brazilian butt lift, where I liposuction fat, usually from the belly, the love handles, sometimes from the thighs, process the fat, and then put it into the butt. So there are no implants, it's your own fat, it's 100% natural, and it can give you some amazing shapes.
So how does it look in comparison to, solid silicone? Does it just, does it last longer?
Well, the fat lasts forever.
Yeah. Is it just like a more, it's natural compared to that? Does it feel
It's more natural in that it's your own tissue.
Yeah.
The implant you don't feel so much because when I put the implants in, I put them under the muscle, so they go deep inside. You don't really feel the implant, it just makes the butt bigger. But when you have implants, there's always potential complications, and it's a lifetime of maintenance that you need to do. With fat, once it goes in, once it's healed, that's it. No more maintenance.
What do most people opt for?
Most people go for the fat, and I recommend fat whenever I can. In some cases, patients either want more of an enlargement than their fat allows, or they're just so skinny. Yeah, it's just not an option. So then implants are their only available option.
Okay, so let's just talk a little bit about the trends that are going on and what people are interested here in Toronto. So in terms of you're talking a lot about the Brazilian butt lift and the implants. Do you find that a lot of the people who come in, a lot of your clients, that they overall have a good figure? That's just something that they want to enhance a little bit, or are they at the stage of their life where they feel like they need to look better because of whatever reason, they're getting older or divorced, or it's just cosmetic, they want to fit into their pants? What do you think?
Most of the patients that are getting butt enlargement and breast enlargements tend to be in their 20s, early 20s, mid 30s. For the butt, what I find is most of them already have a pretty nice butt. They just want to go bigger. With the celebrities like Kim Kardashian, Nicki Minaj, and others, having a big butt is now very popular. So people that would have what I would call a normal butt want to go bigger. That's different with breast. I would say when it comes to breast augmentation patients, about 80% of the women that get breast augmentation have A to B cups and like to go bigger to a full C or a D. Very few women come in with a C cup wanting to go much bigger.
Do you have different sizes of of the butt implants?
I don't have a lot of selection for butt implants.
Yeah.
Normally what I do is I show patients pictures and it's really based on measurements. Now, for butt implants, they are slightly different than breast implants, so it's a discussion that we have during consultation with patients. There's a difference in the feel, the shape, and the size.
Have you ever had a client where you totally disagree with the size that they want and you say, it's too big?
Absolutely.
Yeah.
Once in a while you get a patient who just wants something that's just unreasonable,
Yeah.
and I tell them, yeah, technically it's possible, I can do that, but you just will not be happy. It's going to look bad for multiple reasons. I explain why it doesn't look good, and that's it.
So you do a lot of different surgeries. So you do the butt, you do
I do
breast. What are some of the other ones that you do?
Probably the most common procedures that I do will be the Brazilian butt lift, breast augmentation. I do a lot of tummy tucks. I do a lot of mommy makeovers, which is a combination of procedures such as a tummy tuck, breast lift or breast lift implants, liposuction, arm lifts, thigh lifts. Also, another procedure that's pretty common is gynecology or cosmetic surgery, such as labia reductions and vaginal tightenings. Labia reductions tend to be more in younger girls in their 20s that are concerned about the way they look. Some people have discomfort with physical activity. When it comes to vaginal tightening, it's usually after childbirth, after having multiple children. It just doesn't feel the same anymore, and people want to have it fixed.
So you also do hymen reconstruction.
Yes, I do.
So what are the age groups or the demographic for that type of
There's
surgery?
no particular age group. People requesting hymen reconstruction do it for cultural reasons, and they can be of all ages. I have patients from their 20s to, I think the oldest one was probably in her 50s, and because of cultural reasons they may need to get this done prior to getting married.
Have you ever had patients come in because their husbands want them to have surgery, like enhance their breast or, even do a butt lift?
I would say a good proportion comes in with their husbands, but it's always the patient that wants it. If a patient comes in and says, my husband sent me to get bigger breasts, you're not the right patient. I'm not operating on the husband, I'm operating on you. So it's very, very important that patients come here for their own reasons.
Yes.
They need to understand why they're having the surgery, and they need to want the surgery.
So speaking of husbands, you also do male breast reductions. Yeah, do a lot of men come in for that?
It's pretty common. Having enlarged breasts in men gives them a lot of self-confidence issues. It's just not something you want to be seen with, especially wearing in the summer. Summer's coming up, being on a beach, or if you're wearing a tight shirt. So having enlarged breasts is a source of anxiety for a lot of men. So yes, gynecomastia or male breast reduction is a pretty common surgery.